During extubation, a lot of times when you're in the hospital and stuff and a patient's intubated, like for instance, if I would go ahead and put this tube in, hopefully, you know, they're intubated, you'll eventually get them extubated. That's the goal. You really should think about extubating the patient before you ever intubate them, make sure that you can wean them or what have you. If you're going to extubate your patient, one thing that you're going to want to make sure that you pay attention to, you're going to raise the patient up to semi-Fowler position if the patient's able to tolerate being raised to such a position. You typically don't want to extubate with them lying flat in the supine position. But during the procedure, you know, you're going to expect a lot of secretions to come up with that endotracheal tube. So those secretions are going to come up within the tracheal tube. So you will have taken an inline suction catheter, you will have suctioned the lungs out one more time. You're going to go in with your suction, oral suction, suction the secretions off the top of the airway. Then you're going to deflate that cuff with a syringe a little bit so that you can assess whether or not the patient's got a cuff leak. You assess that they do indeed have a cuff leak, and then we're going to pull the tube out. When we go to pull the tube out, one, you want to make sure that if it's taped, you've got all that pulled loose so that the tube will come out. Have the patient, you tell them you're going to deflate the cuff, have them take a deep breath. So they'll take a deep breath. The reason you ask them to take a deep breath as you're withdrawing the tube is when they take a breath, your vocal cords are going to open up as wide as they can. So they're taking a deep breath, they're going to open up wide, and then you can pull that tube out. So now, once the tube is clear to the vocal cords, that's when you tell the patient to cough. Sometimes people get it backwards that when you're pulling tube, cough, cough, get the tube out, like they're coughing the tube out. You don't want to do that because if I'm pulling the tube and I'm coughing, those vocal cords are going to kind of slam shut. So take in a deep breath, pull the tube. After the tube is cleared, that's when they should cough. And as they're coughing, they're going to have some stuff come up, spit up, suction it out, and you're good to go. So that's going to be where we operate as far as how and when to cough. Yes, they should cough during the extubation procedure after the tube is cleared. They do not cough, or they should not cough. They should not be instructed to cough as you withdraw in the tube, because as you withdraw in the tube, it might make it more difficult to get that tube out. Deep breath, as the cords are open, pull the tube through, and then once you've got the tube cleared, then it's cough, 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 go ahead and suction it out.